AWWA would like to take a moment to thank today's sponsor, HD Supply Waterworks, an operating division of HD Supply. HD Supply is the nation's largest distributor of infrastructure products that serves both contractors and municipalities in all aspects of the water, wastewater, clean water, landfill, energy, and fire protection industries. HD Supply Waterworks is dedicated to taking care of each other, our communities, and our environment. As a leader in the waterworks industry, the company is proud to sponsor today's event to help foster collaboration among key stakeholders in remedying this common concern of lead service line replacement. They are represented here today by Andy Santee, Director of Marketing and 26-year AWWA member. Thank you, HD Supply.
Welcome to this American Waterworks Association special event, Getting the Lead Out. Vital tips from leading utility managers. Presented at the National Press Club in Washington, D.C. And here is your moderator, the CEO of the American Waterworks Association, David LaFrance.
Our next guest is Reid Campbell. Reid is the Director of Water Services for Halifax Water, where he's responsible for serving 350,000 people with safe drinking water every day. Reid will discuss Halifax's lead service line plan and recent changes to address the need for full service line replacements. Please join me in welcoming Reid.
So we've been working on lead service lines since the 50s, and about 5 years ago we put some more structure around it, made it into a program, but then a few years ago some research we were doing caused us to reevaluate some things. So right now we're sort of considering how we can go forward in a more meaningful way. So we have about 83,000 service connections. At one time, we probably had 15,000 public or lead service lines, and today we've got about 2,500 public lines. We have no idea how many private lines we have, and I'll speak to that a little. I think it might be about 10,000, but that's probably just a guess. We do corrosion control, and for what it's worth, we've always been compliant with our regulatory compliance system. So one of our pre-existing utilities, the City of Dartmouth, in the 1970s, as part of an economic redevelopment program, they replaced the vast majority of their service lines over a 2-year period. Problem is they did nothing about the private lines at the time. The Halifax Water Commission always had 2 programs in place, one of which is quite common when the city's doing street or sidewalk renewals to go in and replace the public portions. And we've also had a program whereby anybody that calls up and says, I'm prepared to replace my private service, we would come and replace the public at the same time. And we've continued that program up until very recently. So we estimate historically that probably only 10% of the people where we've gone in a proactive way and replaced the public lead service line have replaced the private. We think the outreach varied over time from very little to perhaps just hanging something on the door. And part of the reason we have no idea is there's no positive mechanism to make people come back to us when they replace the private portion. They're supposed to come back and tell us so we can inspect it, but there's no mechanism to make them do that. So as a result, we've got no reliable estimate of how many private lead service lines. Another issue we've had with our historic approach is the city's pavement management program. A lot of times we go into neighborhoods, we get people excited, we do the proactive part, and a couple streets over the city's still paving, and then 2 months later the neighbors would find out and we would want to replace their lead service line. Of course, the city didn't want us cutting the street. They have a 5-year moratorium on new pavement. We've always won that argument, but every single time we have to go to the city and make the public health argument to let us do that. So a little bit about the regulatory framework in Canada. We've got a maximum acceptable concentration of 10 micrograms per liter, but that's a flush sample after 10 minutes of flushing. We will always pass that number. Health Canada has a guideline on controlling lead corrosion in the system. And without getting into all the details, it's very similar to the lead and copper rule or the lead portion with 90th percentile sample set. The Health Canada guideline, the 10 micrograms per liter, that's largely accepted across Canada. A couple provinces, Ontario and Alberta, have their own approach, and in Nova Scotia, the only requirement that I have to meet my permits is to provide water that's non-corrosive to lead. There's no discussion about how I do that, what that means, or what testing is required, but our utility voluntarily follows the Health Canada lead corrosion guideline. So across Canada, the adoption of that varies. In 2006, we started a research chair. We sponsor a research chair with the Natural Sciences and Engineering Research Council of Canada and Dalhousie University. And since 2006, a fair bit of the research has been on distribution system issues, particularly lead. And I'll just review some of that quickly. First one in 2011, Knowles and Gagnon, we were about to switch to chloramines, and this study was to look at the implications of that. And that study convinced us not to switch to chloramines because it would have created a lead problem for us. But the other time, Health Canada tells you to sample for lead in the summer because the lead's more soluble with the warm water. We found out that our highest lead time is in the winter, and we related that to, because of the cold water, we have higher aluminum residual from our treatment process, and we believe there's a link to the aluminum with the lead. Element Camara did a study in 2013. This was published in the journal. He confirmed what's now widely accepted, that partial replacements are a problem, but what was very interesting to us, he linked persisting high lead levels from partial replacements to the pipe material, sometimes to the pipe of iron corrosion products in the iron pipe. Ben Truman just recently completed some work, and he started doing 12 consecutive samples after stagnation. I don't think too many people are doing 12, but it's very surprising to us in places where the first liter or the first 4 liters were fine. People in their 8th through 10th samples had high lead levels, so that was bothering to us. Brad McElwain did a study on the Dalhousie University campus in 2010. We looked at 35 homes that the university had converted to offices, and we did the 90th percentile sampling, and that reconfirmed that our sampling protocol was working. But he found issues with drinking fountains in public buildings, and he was able to relate it down to individual brass fittings within fountains. He found individual fountain types. We found one in some public buildings that were recalled where the chilling reservoir actually had a lead liner to it and was recalled in the 70s, but they were still there in the university. And then we participated with Michelle Prévost in her study that linked drinking water to high lead levels in children. So the conclusion for us was compliance sampling tells us absolutely nothing about what the lead exposure is for our customers. We think it's very, very complex. It relates to water chemistry, it relates to the geographical location of where people are, and it relates to our water chemistry. And the partial replacements do make things worse. So with us only getting 10% uptake on people doing the privates, we felt we had to abandon that proactive program in 2013. We were getting the bulk of our replacements because we said if only 90, how can we go in and do that if we're making things worse for 90% of our customers? So we think we need to get all the lead out, but that's what we've been struggling with for the last several years. And so this is just quickly, this is 5 or 6 years of stats on our replacement, and we were over 50 in some years, but now we're down to 25, and we sat and looked at it and said, okay, well now we have a 100-year program to replace all the lead service lines, and we just really didn't think that that was publicly defensible or a place that we want it to be. So our current policy is we will replace a lead service line immediately following a private replacement. Then when there's a planned or unplanned disruption of a lead service line, or we have to go in and replace a section of water main that has one connected, we will replace the lead service line. We'll try to encourage the customer to replace the private. But if they don't, we go in, sometimes we'll even sit in their living room. We have a sampling program. We sample pre-construction, we sample post-construction. We've stayed with customers for 2 years in some cases, waiting for the lead levels to come down and providing them information on how to reduce the lead level in their home. So right now, what our program consists of, we have a residential program. We do 100 homes per year that we do overnight stagnation samples to get our 90th percentile number to monitor that. And we report the results to all the customers. We do treatment with zinc orthophosphate, and that's the bulk of our corrosion control. We have do monthly monitoring of water chemistry in the distribution system. That helps tell us if the corrosion control program is working. We also have corrosion coupons of lead, iron, and copper out there. The jury's mixed on the value of those, but we do find a link to how our corrosion control program is working with the performance of the coupons, so we keep doing that. And as I said, we will replace lead service lines when people commit to doing their own. Every time we replace a lead service line now, if we can, we go in and do pre-construction sampling with the owners and we do post-construction sampling up to 2 years until we can see that the lead levels have stabilized again. So we believe that it's necessary to get all the lead service lines out. So we need to find where our private ones are, and we've got to do the 2,500 public ones that we have left as quickly as possible. The thing for us is we don't believe we can do the public ones unless we can bring the customers along to do the private ones. So why don't customers replace lead service lines? And this is anecdotal from people we've talked to. It can be $1,000 to $10,000, and $10,000 comes in when you have a 100-year-old oak tree or a 10-foot high retaining wall or something over your lead service. We have a lot of elderly homeowners that moved into the home. The kids have grown up in the home. They're getting ready to retire. We found absolutely no interest. And just with the age of the homes with lead service lines, that seems to be a lot of the people that have them. We find a lot of people, once they understand they're not part of an at-risk population, their level of interest goes down. And we really think people just don't believe it adds value to the home. Even if they're understanding what we're telling them, it's buried. They're thinking about a new kitchen, they're thinking about a new deck, and replacing a lead service line, that's just doesn't get them excited that way. So we're prepared to do our part. We think if we can do them over 30 years, it's about $25 million for us, but we can only replace it if we could figure out a way to get the customer to come along. So we think education's needed, and we think somehow, and this is a lot of our effort is going into now, is how do we find some financial assistance for the customer. So we think some of the things we're planning to do, and we've found anecdotally this works, we really need to go in and market to customers. We need to find neighborhoods where there's a density of lead service lines, or neighborhoods where there's a community of interest in replacing them, or the need's greater because of sensitive populations. And we think we have to get in homes and sit in people's living rooms and show them lead data and convince them to come along. We need to increase our capital budget to replace them. We need to go and work with the city on their pavement management program. We're talking about tripling our rate of lead service line replacement. That's going to triple the cuts in the street. And it's not that they don't understand public health, but we're dealing with pavement guys, and they like their pavement to stay the same. We need to figure out where our lead service lines are. Now, fortunately, we hope to embark this year on an AMI program, which will cause us to go in all 83,000 premises, and that'll be an opportunity to collect lead service line data. And we need to deal with the limitations that customers see. So just, these are a list of the questions. These are things we think we need to work on over the next year to get a more transformational program in place in our utility. People have referred to the social justice type questions. We think there's people out there that aren't going to replace unless it's free. And what do we do about those folks? Even if we find financial assistance to people, we know there's a population that won't replace unless it's free. How do we work with the pavement management program? How do we do the same type of work now at triple the pace? And we'll figure that out, but that's something we can do. How can we move the real estate sector? We believe that an ideal time to flag this is when the house is sold. We've been meeting with the real estate people to educate them. They're very interested in having us talk to them about lead. We've tried to get them to put lead service lines on the property disclosure form, and we're finding that to be a fair bit of a battle. We need to figure out how long will we have to work with individual customers to convince them and bring them along. Sometimes I don't think we've given them enough lead time to plan for that, so we've got to figure out what's an appropriate lead time for people to plan and do that. And do we think we can encourage enough customers to move along? Just two more thoughts. One, in the UK, they're less into lead service line replacement, but they're more to treating it with phosphate. We've retained some expertise from the UK, and their approach works in their environment. Our advice was, and this just got us thinking, you need to triple your phosphate dose. So to me, the cost of tripling my phosphate dose was $800,000. That's about a 40% increase in our treatment plant chemical budget for all chemicals. But then we got looking at it, what's the cost to triple our lead service line replacement? It's about the same. And we thought, well, we can replace a lot of lead service lines for the cost of doing the phosphate, and we think we have to replace them anyway. And then the final thought, we need to work in partnership with our customers. And it occurred to me, so what do water utilities do well? We know how to work in the street. We know how to get utility permits. We know how to do the sampling. We know how to understand the results and explain that to people, and we know how to do construction. And that's one of the biggest barriers for our customers. We demand a lot of that from our customers to replace that, and they're not good at that. They don't understand that. They don't have the training to do it. So we've got to create a paradigm where we're working in consultation with our customers to get that done. With that, thanks for your attention.
Thank you, Reid. And obviously, the US EPA doesn't apply to your utility.
That's right.
And I just couldn't help but note in your conversation sort of a repeated theme of a little bit of a lackluster response on the part of your customers to jump on the offers about replacing lead service lines. And then, but also your utility's commitment to making sure that lead service line replacements happen. Can you talk just a bit about how that commitment plays against other priorities that your utility might have in its programs?
You know, I think the actual cost of us replacing the lead service lines is not a huge cost in our overall capital budgeting, but I think it's going to take sort of a different way of doing business. Like we're convinced that we need to actually do this outreach and go and sit in people's homes. That's probably hiring staff that we don't have today. That's probably skills. We're doing that today in 10% of people's jobs. We think we need to make that a commitment. So, you know, we're doing things right now. We've just had a meeting 2 weeks ago with 2 deputy ministers at the province of Nova Scotia to try to get them to understand the problem. That was very successful. We're meeting with a committee of our board in a couple of weeks, and we're going to be meeting with the medical officer of health soon. And so far, the response we've had has been pretty good.
Well, I think if you came and sat in my home for 2 years, we'd find a way to help you move on.
I'll keep the same. Thanks.